So in general, which diet plan is best? There's a lot out there. Weight Watchers and Jenny Craig, a lot of these things are focused on, counting calories. That's like 1995. Let's not use those things anymore because and assigning points, because they don't talk about a lot of the fundamentals that we're discussing. You can get 2 points for drinking a soda, which is the worst thing for you, pretty much, right? So that is not a great system, and I've seen time and time again patients fail. They do well, they're losing weight, but they usually gain it back plus a heck of a lot more because they're never taught how to eat, right? And that's part of the problem. Mediterranean diets, plant-based diets, vegan diets, right? All these things can be helpful. DASH diets, especially for those who have high blood pressure, Whole30, Atkins, South Beach. There's lots and tons and thousands of programs out there, right? Which one is best? Which one do you think is best? Good question. What are the key elements of a good weight loss program? This is according to one practitioner. In my opinion, first starting with something that's anti-inflammatory, avoiding what I call the 5 big guns. That's sugar, dairy, gluten, corn, and soy. If people can avoid those things, usually you're well on your way to losing weight, at least 5 to 10 pounds in the first month or two. Really that's just reducing inflammation inside the body. A lot of weight is actually caused by swelling and inflammation because our body is just overrun with these kind of toxic metabolites. Avoidance of individualized inflammatory foods. This is where food sensitivity testing can come into play because you can identify specific foods that patients are reacting to. So this is the IgG food map from Mosaic Diagnostics. I think it's a fantastic tool. It was part of my toolbox to be able to help me to lose weight earlier in my life, finding that holy tamale, I shouldn't be eating dairy and gluten. Those are like poison for me, right? And when I eliminated those things, it was not just that my body changed, but my mind changed. I can't express how profound the cognitive changes were when I eliminated certain foods that were preventing me from living my life fully, mentally. So I really, really love this type of test to be able to help our patients identify specific foods that might be causing problems for them. Whole foods-based diet. No, this is not one created by Jeff Bezos, although he probably would like you to think that. That way you spend more money and he becomes more of a billionaire. This is without processed or fast foods, right? Eating foods in their purest forms. Shopping, having our patients shop on the outside of the grocery store. Fresh foods, fresh meats, fresh vegetables and fruits, less processed foods. That truly is one of the key elemental processes in losing weight. And again, there's so many diet plans out there, right? But all of them, a lot of the best ones, really that's what this is. It's an anti-inflammatory diet that somebody has slapped a label on and made a lot of money on. This is the key, right? These are the keys. And as we alluded to earlier, 3 months. Have a patient stay on it for 3 months to change their habits, to change the patterns, to feel what it feels like to feel amazing rather than saying, oh, I tried it for 3 weeks, I'm done. It didn't do anything for me. I only lost 2 pounds and blah, 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 right? And let's get back into our repatterning of telling yourself that it's not going to work for you. And so that you can go back to eating the same foods again. You have to break the cycle. Sorry for that loud clap, but I'm very passionate about this. This is the part that I love the most, is about the motivation that we can be expressing to our patients and sharing these valuable foundational tools to help them to not just lose weight, but keep the weight off long-term, right? So usually when I have patients start on the anti-inflammatory diet, a lot of them feel better, right? Again, some of the things we talked about, they lose weight, their joints get better, right? Their bowel movements improve, they have better energy, their brain fog starts to dissipate, and they want to continue on it long-term, right? That's the goal, right? So again, being committed to not just losing weight, but to long-term wellness. Let's think about health span, people. Let's not just think about like, okay, I want to lose my 5 pounds so I can fit into my bikini and, go to my beach vacation and look great. Yes, that's great. You should look great and feel great on your vacation. But then don't go on your vacation and drink like 800 glasses of booze every day and fall off the wagon, right? Let's think about these things long-term wellness. It's not a quick fix. It's a desire for life. That should be the focal point here. So again, understanding a person's physiological, hormonal, behavioral baseline. That's what we talked about before. Avoidance of inflammatory foods, understanding what foods are problematic for that individual, healthy blood sugar regulation, protein and fat at every meal, making sure to feel satiated, right? One of the slip ups that most people make is that they eat too many carbs that are naked. Then they do not regulate their blood sugars. Then inevitably what happens is that most people, their blood sugars are not balanced and they tend to eat more at night. They eat more off the plate. They eat out of the bowl. They eat snacks. They eat a dessert. They eat multiple desserts. And then the vicious cycle continues, right? So really making sure that protein and fat are eaten at every meal prevents that from happening. That is the strategy. People will feel better and will not reach for those second helping or the dessert after dinner. Incorporation of at least 5 to 8 servings of vegetables per day. Limiting fruits. I'm not a big proponent of eating a lot of fruit. I don't think we need a lot of fruit. And if people are going to eat fruit, eating low glycemic index fruits. That's your berries, apples, oranges, and pears. I would not eat things like tropical fruits, bananas, mango, papaya, and pineapple. All those things, lots of sugar, high glycemic index, right? And if you're going to do those things, eat protein and fat with them to negate the effect of the sugar. Avoidance of high fructose corn syrup, really problematic. We'll talk about that next. Incorporation of 4 to 7 days per week of moderate to intense physical activity. Yes, love that. And drinking adequate amounts of water throughout the day. I like how I love my own love my own point. Yes, I love that. It's as if I didn't write this. All right, other weight loss strategies. Set realistic, achievable goals. Gradual weight loss at 0.5 to 2 pounds per week is recommended. It may be more, it may be less, depending upon who the person is and what they have going on in their life, right? Again, if they're a menopausal female, it might be much more challenging to get to that 2 pounds per week mark if they're not a male who's 23 years old with good testosterone levels, right? It just is going to be variable for each person. Plan ahead and meal prep. God, yes, absolutely. I think this is probably one of the most important things. If we know what we're going to be consuming, I grew up in a family where we're eating breakfast and we're talking about what we're having for dinner, sometimes the next day's meal. So planning ahead is really, really important. And meal prepping, if there's not a lot of time, which I know a lot of people are, they're on the go, they've got kids, planning to meal prep for at least 3 days can be great, because when you're not prepared, what I've seen is that people then reach for things that they're not supposed to be reaching for, or they go through the McDonald's drive-through, right? And then you're kind of going back to the falling off the wagon and going back down the wrong trail. Cutting calories below 1,200 calories per day is not a good idea, in my opinion. The chances of failing due to cravings and hunger taking over or yo-yoing are much higher. So I really do not advocate that. Portion control, right? Making sure that your plate is full, but not going beyond what you should be eating. Stop eating when you feel full. And behavior modification. Focus only on eating. Do not eat while you're watching TV or being on the phone. I think we're all guilty of this in this day and age. Most of us watch TV or watch movies or staring at our phone mindlessly. But that prevents us from, unfortunately, mindful eating. Taking the time to enjoy food, savoring each bite, because usually what happens is when you do that, you create more amazing digestive juices, you have better digestion, and you feel fuller. That's the key. Is protein a key? Yes. As you've already mentioned, protein is a key to helping to lose weight. It decreases fat mass. It preserves fat-free mass in both low-calorie and standard calorie diets, right? So usually what we want to be recommending is that long-term clinical trials show that a high-protein diet provides weight loss effects and prevents weight regain after loss, okay? The other thing, the common misconception is that high-protein diets cause kidney problems and bone density issues. That is not true. Yes, high-protein diets may not be helpful for people with renal failure, but everybody else, no, that is not a true statement. There has been no research that has shown that a high-protein diet causes deleterious effects in people who are healthy, relatively healthy. So let's not go there. These are some of the effects of high-protein diets. Really, a lot of it has to do with the fact that it modifies our hormones and our neurotransmitters and the way that we process different types of nutrients inside the body. Again, increasing fat-free mass, increasing fat burning, increasing the burning of stored fat, increasing these other types of proteins that we just discussed, increasing GLP-1. Oh, look, that's interesting. A high-protein diet has an equivalent reaction that does Ozempic and Mounjaro. Yep, exactly. Same phenomenon. It's exactly what I've been talking about. Increases satiety. Protein is a satiating macronutrient. It decreases food intake, increases energy expenditure, and negative energy balance, which can create weight loss. How about fat? Does it help with weight loss? Fat is your friend. It is a satiating macronutrient. Back in 1995, all we thought about was low fat this and low fat that. But unfortunately, all the low fat products had what? Had sugar, right? They had more artificial sweeteners and caused more of a problem, in my opinion. So I'm not saying go and gorge yourself on bacon and cheese like the Atkins diet says, but the type of fat and the timing matters, right? We can get into a better zone of having more ketones as opposed to having our brain and our body rely upon sugar for fuel. It is called the metabolic switch. That really is key for helping to feel satiated and helping the brain recalibrate to not always rely so much on glucose, right? So that is really, really important. High fructose corn syrup is evil. I'll just tell you that. Obviously, the rates of eating this stuff has increased by 1,000%, right? Corn sweeteners represent 20% of total daily carbohydrate intake. What? 20% of people's carbohydrate intake. Yes, there's also a high link between metabolic problems, between what we call non-alcoholic fatty liver disease. We're actually referring to this as metabolic liver disease in this day and age, and because of high fructose corn syrup. Why does this happen? Because it turns directly into the fat, in fat into the body. So it crosses over the membrane, it goes into the portal circulation, goes into the liver, and turns directly into fat. Causes steatosis. Not only that, but then we start to release triglycerides into the bloodstream. That causes hypertriglyceridemia. So any patients who consume a lot of high fructose corn syrup, you will see metabolic problems. And then we store those triglycerides in our fat tissue. That creates visceral adiposity. So you want to be able to help patients to lose weight effectively and burn fat, have them stop drinking soda or other things that are sweetened with high fructose corn syrup. A few other nutrients that I really like for helping to patients to lose weight. Berberine is one of my favorites. It activates this thing called the adenosine monophosphate kinase pathway, which has been coined the master metabolic switch. It's been shown to be involved in lipogenesis, the down-regulating lipogenesis, upregulating those that are involved in energy expenditure, helping with GLUT4 translocation, as we discussed earlier, and stopping lipid accumulation. Usually I recommend 500 milligrams once a day, up to 3 times a day, depending upon if a patient's diabetic or depending upon where they're starting from. But 500 milligrams at least once a day would be recommended for most people. You can see here 300 milligrams of berberine. That's a pretty low dose. After 3 months, 3 months, metabolic syndrome patients showed a decrease in their BMI and leptin levels, as well as leptin adiponectin ratios, and this thing called HOMAIR. That is a research parameter for measuring insulin resistance. So that's just 300 milligrams per day. Pretty cool. This is some of the pathway here. I did want to mention this is that you can see, oh, look, it activates GLP-1 again. Interesting. Do we need Ozempic? Or patients might be able to take berberine instead to be able to cause a similar reaction to happen. ALA, alpha lipoic acid, is also really great. It's a free radical scavenger. It's also involved in blood sugar regulation. It's been shown to be helpful in modulating insulin sensitivity, helps to improve insulin sensitivity, and it also seems to some degree to help patients lose weight independent of dietary modification. It seems for some patients to be able to reduce appetite. So that's in some people. I wouldn't say maybe in everybody. Magnesium should be part of anybody's weight loss protocol because of its role in helping to fuel biochemical reactions. So really, really important. I do typically recommend magnesium glycinate, not the oxide form or citrate. I want to be recommending glycinate so it doesn't cause bowel movement irregularities. 120 milligrams per day up to 3 times a day would be recommended. B complex, B vitamins in general, this is like basic biochemistry, is that they help in metabolism of pretty much every macronutrient. So it helps to stimulate and metabolize better. So it really, I think a simple B complex can be very helpful for patients looking to lose weight. And lastly, 5-HTP, 5-hydroxytryptophan. You can see that some patients might be able might benefit from 5-HTP, especially those maybe who have an altered microbiome. I do like 5-HTP, typical dosages from 50 to 300 milligrams per day. So that would be another strategy for some patients, especially think about your patients who might be a little depressed. That might be a good reason to use 5-HTP and even measuring neurotransmitter levels. I will talk about a quick case and then we'll wrap it up. So this is a 57-year-old postmenopausal female. She had stage 1 breast cancer, fatigue, and overweight. She was positive for ductal carcinoma in situ of the right breast, ER positive, PR positive, HER2 negative. Patient had a lumpectomy and radiation. Said her weight has always been a struggle since she went through menopause. It's become nearly impossible to lose weight. She's 40 pounds overweight, with the majority of her weight around the midsection, also the hips and buttocks. That's the apple kind of body composition. She's tried many different diet plans over the years. None of them have worked long-term for her. She's yo-yoed with her weight for over 20 years. Since her diagnosis 7 weeks ago, she's made some shifts in her diet. She's eliminated meat and animal products, and, quote, she thinks she eats well with, quote, eats plenty of carbs, eating oatmeal or smoothie, banana or berries with plant-based protein, green powder, water for breakfast, salad for lunch, and steaming vegetables for dinner. She does still have a few Diet Cokes and frozen lunches due to being busy at work, and the truth is she misses honey and sweets. Who doesn't? Energy levels, she has to push herself a lot and tends to overwork. She has more reserve than most, but she's been fueling herself for adrenaline for a decade or more. Oh, that's a very interesting clue. So maybe her adrenals are a little bit burnt out. 6 months before her diagnosis, she was only sleeping 5 hours per night. Another clue. Now she gets 8.5. She can't get enough sleep. She's trying to play catch up. So energy levels, 3 out of 10 in the morning, early afternoon, 9 out of 10. So she does have kind of a rise. Doesn't nap, tends to dip after she eats. Another clue that blood sugar is probably imbalanced. And after 7 p.m., she has no energy left. Movement up until about 40, she was doing pretty good. Then she had frozen shoulder. She stopped running, hiking, and weight training. And for the past 17 years, she's never really gotten back into exercise. She walks her dog. That's a light walk, but she would like to get back into exercise. Environmental history, 50 to 70% organic. She works a lot. She has a tendency to eat frozen food for lunch, and usually it's non-organic. Gets sick very seldom. She would get UTIs when she was younger. Also, she had dental work. She had mercury amalgams, and she regularly consumes farm-raised salmon, which, of course, is high in PCBs. When we look at her lab, she has high levels of ferritin. That's not related to iron. This is a metabolic marker. She has pretty low levels of vitamin D. I like to usually see people between 70 and 80. So vitamin D has been shown to be low in patients who are obese, and it has been shown to be helpful in patients to lose weight. Triglycerides, this is related to fat, sugar-derived fat. The higher the level of triglycerides, the more the patient is not regulating their blood sugar levels. She has a very high CRP. That is an inflammatory marker. She has a high level of homocysteine, which is also related usually to B vitamin problems. So clearly there's something happening metabolically. Her hemoglobin A1C, which is a long-term measure of blood sugar control, is at 5.6, which is right on the cutoff point. So really, this is the time for her to make changes. And her insulin levels here are 12.7. I like to see people's fasting insulin, that's what this is here, between roughly 3 and 9. That's my cutoff point. So there's a little bit of insulin resistance happening here. And then lastly, her thyroid is a little bit imbalanced. I like to see the TSH usually between 1 and 2, and the free T3 levels between 3.3 and 4.3. So there's a little bit of thyroid imbalance. And then lastly, last clue, she does have low levels of all of her hormones and very, very low levels of cortisol in the morning. It's not surprising, given the fact that she's been under this high stress for a very, very long time and kind of running on adrenaline. There is a relationship between upper body obesity and a risk for postmenopausal breast cancer. So that's one thing to be thinking about for those patients. And so for this patient, again, we focused on the things we've already discussed: better blood sugar control, right? 3 protein meals per day, plus veggies, low carb diet, no diet sodas, only dark chocolate sweetened with monk fruit or stevia. Recommendation of resistance exercise plus brisk aerobic activity. I recommended berberine for her. It's 1,000 milligrams per day. I recommended 400 milligrams of alpha lipoic acid. I recommended 4 grams of fish oils per day and 5,000 IUs per day of vitamin D. So I also recommended ADR formula. This is a adaptogen combo with adrenal cortical extract formula. That's 2 capsules in the morning to help her get going, to help replenish some of the cortisol that she's missing. And I did recommend thyroid hormone replacement therapy for this patient, 60 milligrams per day of desiccated thyroid to help to improve her energy and stimulate her metabolic rate. 3 months, again, our 3-month window, the patient came back. She was ecstatic, feeling the best she had felt in a long time. The dietary changes she said were hard to adapt to at first, but she was fully committed after our conversation, especially about the relationship between metabolic health and cancer. So that was a really important motivating factor for her, right? I have cancer, but I also have these metabolic problems. What can I do to help myself reduce the recurrence of cancer? And I was like, the metabolics are the fundamentals for you. You have to get that under control. So she began to walk more briskly for 3 miles 3 times per week. Awesome. I hadn't started resistance training, but she was more motivated to do so. Her energy had dramatically improved in the morning. The changes didn't happen overnight, but she was hitting her stride after about 4 weeks. That's kind of when I think the thyroid medication started to kick in and the ADR formula started to kick in, and just kind of making those changes, she felt lighter. And speaking of lighter, she lost 9 pounds in 3 months. That was dramatic for her, considering it was so hard for her to lose weight. Most importantly, her lumpectomy was successful. She had her medical oncologist, were encouraged by her health changes and how it would impact her ability to stay in remission long term. People are always desiring to lose weight, feel and look better, but there's truly no magic weight loss pill. Otherwise, somebody would be a trillionaire if they discovered it, right? We're still seeking the holy grail of weight loss. So for us as functional medicine practitioners, it's important that we really listen to our patients for clues in our conversations, using functional medicine testing so we can best identify root causes for why they're having a hard time losing weight. I am obsessed with the why. So it's important for me to understand the why so that way I can really, truly help my patient. When we're armed with that information, we can guide them on their journey to weight loss and hopefully with a long-term commitment to better health throughout life.